Senator Warren.
Thank you, Mr. Chairman. So, according to a 2013 survey by the Massachusetts Medical Society, nearly every doctor in the Commonwealth that works in a practice with 10 or more providers, and 75% of doctors in smaller practices use electronic health records. Unfortunately, more than 2/3 of the physicians in these small practices reported that implementation of an EHR either significantly or somewhat slowed down their practice. Okay, but here's the key. That same survey asked doctors what they would recommend to fix EHRs, and the number one answer they gave is make their system exchange medical information with other doctors. So, I'd like to start with you, Ms. Moss. How has Coastal Medical's EHR, which exchanges patient information with major hospitals in Rhode Island, helped improve patient care?
I can't even tell you the difference. I mean, I've got some measures here, and I'm looking at influenza for our folks over 65. Flu vaccines save lives. In 2012, we gave shots to 57% of our patients. Over 65 last year, 93%. I mean, I think we could say we could have saved a life or two there. BMI, same thing, 64% 3 years ago. Now 93% of our patients have BMI measures and follow-up. And if we can share, as you say, with specialists, and we're really just starting that. I mean, we get direct feeds right now from Current Care in Rhode Island for all hospital admissions, ER. We have a transitions team that's just helping those patients transition back to the office and home. I think we're making a difference every day, and without that information, we wouldn't know what to do.
Well, that's very helpful, Ms. Moss. Thank you very much. Doctors have been willing to work hard. They've invested time. They've invested money to implement these systems because they were promised that EHRs would accomplish three things. They would improve efficiency, they would decrease cost, and they would help the doctors provide higher quality care, as Ms. Moss just spoke to. And for those doctors who are part of practices that have the resources and the will to make their systems exchange data with other providers, it appears that that promise has been fulfilled, or is certainly along the way. But for most doctors around the country, especially doctors in small practices without the resources of a large healthcare system, there's still a long way to go. Clearly, the technology exists to make interoperable records that can exchange patient information, but doing so can be both costly and have administrative burdens. So, Mr. Pletcher, what barriers did you have to overcome to establish the Michigan Health Information Network Shared Services, which promotes the regional exchange of health information?
I'll tell you shortly about a statewide ADT use case. That's letting doctors know when their patients have been in the hospital. And typically, doctors know that about 27% of the time on their own, but the rest of the time they don't. When we first asked all the hospitals to start sending this notification out, they were highly reluctant. When we packaged up the use case and then we were able to get incentives behind the use case, essentially part of their population health incentives paid them to say you must send or you don't get the incentive, they all started sending in very short order of time. Then incentives lined up with doctors being able to receive that same message. And if I graph the utilization and the adoption, remarkably, it tracks to how the incentives were paid out or when the deadlines for them occurred. This results in real patient value. It shifts some of the workload sometimes away from the doctor to other folks. I just attended a presentation last week where a care coordinator basically who was doing maybe 3 to 5 transitions of care activities a month is now doing 40 a month. That's a 10-fold increase.
Yeah.
And some of those things are little things where they notice a pattern that a patient's been going to the emergency department on a regular basis on the afternoon on Saturdays because theoretically they're lonely. And all they do is place a call on Friday saying, by the way, Mrs. Jones, we're open on Saturday till noon if you want to come in, and you're scheduled for an appointment in a couple of weeks. and they say, oh, okay, and it's just enough to tip the balance. There's lots of little things that can fix this problem. It's sort of death by 1,000 cuts. People are trying to swing for the fence when really it's lots and lots of little tiny things that add up to make a difference. And that's why it's so important to not just think of this as all around the doctor, which is very important, but also the implications. Those extra minutes that a provider takes helps inform a much wider circle of people that can interact and take care of the patients too, and ultimately help reduce the sort of demand in some cases for overworked and busy providers.
So I want to thank you both, and I know I'm out of time here, but I just want to say that you make it clear that we need to create interoperable healthcare record systems so that all the doctors and their patients and everyone who's trying to help the patients can realize the promised benefits of a health exchange system. Interoperability is a top concern for doctors in Massachusetts, and I hope this committee will take real steps to address this problem. Thank you, Mr. Chairman.
Thank you, Senator Warren. Senator Collins?